Okay, going on to compliance. This compliance has to do with not only HIPAA, but also fraud and abuse. You've got several questions on HIPAA and you have several questions on fraud and abuse. They want to see that you truly understand the difference between fraud and abuse. So within this section, we're not only going to go over what HIPAA is, what it includes, the parts of it, but also the different examples of fraud and abuse. So HIPAA, it is the privacy rule which provides federal protections for personal health information, PHI, held by covered entities and gives patients an array of rights with respect to the information. So except for they can't, it's denied due to the potential danger to the patient, such as psychotherapy notes, information compiled for the anticipation of or for the use in legal proceedings, and information exempt from disclosure under the CLIA, which is the clinical laboratory. What is not included under psychotherapy note exception is medication prescription and monitoring, counseling sessions, stop times, modalities and frequency of treatments, result of clinical test, and summary of the diagnosis, functional status, treatment plan, symptoms, prognosis, and progress to date. So the things that could negatively impact the patient's mental as well as improvement are denied. They don't necessarily have to have access to that. Applied to covered entities. The covered entities are clearinghouses, providers, and health plans. The clearinghouse is the go-between for the provider and the carrier. The HIPAA privacy, it created the national standard to protect individuals' medical records and other personal health information by giving patients more control over their information. It's setting boundaries on when, how, and whom for what the purpose can be used and disclosed. And it also holds covered entities accountable with civil and criminal penalties. So just because you have it doesn't mean you can release it. And those that work for providers, unless there's a reason for you to have it, you should not access patient information. Enacted to address the gaps that existed across the nation due to uneven patchwork of federal and state privacy laws. Under this patchwork of laws, personal health information could be distributed without either notice or authorization for reasons that had nothing to do with the patient's medical treatment or healthcare reimbursement. So we wanted to make sure that that was established. It establishes a federal floor of safeguards and conditions to protect confidentiality of medical information. Also, state laws, which provide stronger privacy protections, will continue to apply over and above the new federal privacy standards. So, what's included? Health plans include your HMOs, your PPOs, health insurance companies, company health plans, and government programs such as Medicare and Medicaid. Your clearinghouses are vendors contracted by the covered entities to process non-standard health information and convert it into standard electronic transactions and vice versa. Your healthcare providers are hospitals, doctors, clinics, psychologists, dentists, pharmacists, chiropractors, and nursing homes, etc., that conduct one of the administrative transactions named by HIPAA electronically. And then electronic, this is one of the questions that seem to trip a lot of people up on the certification. What's considered electronic versus not electronic? Electronic means that you use the internet or web-based systems, and it does not include a fax or voice-based phone system. So you can't fax it, you can't print it out. It's not considered electronic. Examples of administrative and financial data. So administrative is your referral certifications, authorizations for services, enrollment or disenrollment to the health plan, and health plan eligibility. So those are your administrative. Your financial data is your healthcare submission for services, process health plan and premium payments. You want to check the status of your submitted claims, healthcare payment and remittance advice, and coordination of benefits. PHI. So under PHI, you have 18 HIPAA identifiers. All of this information, if you are utilizing it or sharing it, it has to be de-identified. So when they talk about being de-identified, this is the information that they are de-identifying. They're either removing it, they're erasing it, deleting it, they're blocking it out so you can't see it, so it can't be used to identify a particular patient. So it's their name, it's their address with their zip code, their date, such as their birthday, admit date, discharge, exact age over 89, because we can find a patient based on that. Telephone numbers, fax numbers, email addresses, your social security number, your medical record number, your health beneficiary number, account number, certificate or license number, vehicle identifiers, serial numbers. So think about on social media when you have a employee of the hospital that's out and they're taking pictures. If you can see those license plates, that's actually a HIPAA violation. Device identifiers and serial numbers, web universal resource indicators, your URLs, internet protocol addresses, your biometric identifiers such as your fingerprint or your voice print, photographic images, and other characteristics such as unique identifying numbers, characteristic, or code. We have confidentiality. So our PHI is protected health information. So it includes information that, again, can be used to identify that patient. Confidentiality, it's the insurance billing specialist's responsibility for maintaining confidentiality of PHI. You've probably read a lot or you actually answered questions on confidentiality within your Cengage information. We talked about some others. For example, you work at a doctor's office. You, your spouse, and your children all see the doctor. If without having an authorization, you shouldn't actually access those records unless you've been given, you went through the specific protocols and procedures just like anyone else walking into there. You can't just up and do that. We've had specific cases where a X has actually accessed, for example, at a pharmacy, found out who the new girlfriend, what medications they were on, and shared that inappropriately through social media and other things. PHI should, in most cases, only be shared with written permission of the patient. So again, you should have to fill out that form. We have privileged versus non-privileged information. Privilege is related to the treatment and progress of the patient. Non-privileged consists of ordinary facts unrelated to treatment, such as the patient's name, address, dates of admits and discharges. Then we have disclosures. So we have disclosures that we have to have authorization. We have patient's agreement that we can or cannot share that information, or we don't have to have authorization to share it. So let's first look at authorization. Authorization means that you have to physically sign that form to access it. So the psychotherapy notes may not be disclosed without authorization except for the use by the notes of the originator, so the therapist. The child's school for permission to participate in sports. You may not disclose a child's PHI information to the school to permit the student to participate in sports activities unless they have that written form. To the employer, unless the information is necessary to comply with OSHA, MISHA, or other state laws. Certain exceptions may apply. So, like with work comp, to insurers, you may not disclose PHI to an insurer for underwriting or eligibility without authorization from the patient, such as obtaining life insurance. And then for marketing and fundraising, think about that HIPAA release, that release you have to sign for your children at school or anything else. If they're going to use your information, your picture, any of that for marketing or fundraising, they need to have that. Disclosures that patient's approval, it just means that they have to say yes or no that you can do that. The person involved with the patient care, such as a family member. So with this, a patient should be given the opportunity to object to sharing a PHI with family, friends, or other involved in their care. For example, if you go into the hospital and you are sitting with a family member, you want to make sure that the patient gives you permission to sit there. Otherwise, the healthcare provider can use professional judgment to share that with the person. So, for example, if we had an elderly or a child that couldn't necessarily give us permission, they would use their judgment to share that. No authorization. So what is it? What it means for the physician practice here. So to the patient, you don't have to have authorization to discuss their information with them. For treatment, speaking with the patient, ordering tests, writing prescription, coordinating care. For payment, obtaining eligibility or benefit coverage information from the payer. For healthcare operations, you don't confuse that with giving permission to have surgery. It's just refers to business activities such as case management, certification, accreditation, medical reviews, or audits for fraud and abuse. So it's not the treatment side, it's the administrative side of things. For public purposes, so for communicable diseases, injury, child abuse, domestic abuse, they actually can release that information to the appropriate parties. For workers' compensation, release of information relating to workers' compensation, such as disclosures to programs that provide benefits for work-related injuries. However, if the doctor does not accept workers' comp, that would not be a case that you could disclose that information. Safeguards. So safeguards, we have administrative, we have technical, and we have physical. Administrative is verifying individuals' identity, picking up the healthcare records. You want to apply sanctions against workforce that fail to comply with security and policy. So who is sharing that information? Perform regular record review, the IT system. So we're going to do audit logs and access reports, and identify security officials responsible for development of the policies and procedures. Next, we have our technical side of things. We want to create usernames and passwords for access, establish procedures to access PHI during an emergency, implement procedures that terminate an electronic session after predetermined time so it logs you out, implement mechanisms to encrypt or de-encrypt electronic PHI. Physical. So physically, how are we going to protect this? We want to have locked, fireproof filing cabinets for storing paper records. We want to establish procedures to allow facilities to access, support restoration of lost data during a disaster recovery plan. Implement physical safeguards for all workstations that access PHI and restrict access to only authorized users. And implement policies procedure to limit physical access to the electronic system. All right, the next section is the fraud and abuse. So we have 18 questions specific to fraud and abuse that go with HIPAA. So what you're going to do is you're going to be asked to identify fraud and abuse, and you're going to use a multitude of examples. So I provided lots of examples so that you could possibly, if it wasn't on the list, you could at least use process of elimination and critical skills to select the correct answer. So examples of fraud. So bill for services or supplies not provided, upcoding, post adjustments to generate fraudulent payment, alter fees on a claim to obtain higher payment, shorten, solicit, offer, receive kickbacks, bribes, forgive deductibles or copayments, split billing schemes, alter medical records to generate fraudulent payment, use another person's insurance card to obtain medical care, leave relevant information off the claim, change the date of service, restate diagnosis to obtain insurance and benefits or better payment, apply deliberately for duplicate payment, unbundle or explode charges, collusion between physician and employee of third party, bill based on gang visits, knowingly bill for the same item or services more than once, or another party bills the federal health care program for an item or service also billed by the physician. So with this particular one, if they bill for services or supplies not provided, some examples are phantom billing, invoice ghost, for office or payment fails to keep or does not notify the cancel ahead of time. So you do have, for example, certain companies, they want to bill you when you do not show up for your visit. However, that has to be billed directly to the patient, not to the insurance carrier. Upcoding is submit codes for complex fracture when the patient had a simple fracture. So more comprehensive. And then there are some other examples on here. If it's a provider fraud, if it's patient or insured people fraud, the insurer third-party payer fraud, or just abuse in general. So again, we have provider fraud, could be the phantom billing, billing for services not provided, upcoding, misrepresentation of services, misrepresenting the diagnosis to justify the payment. For example, that diagnosis wasn't documented in the record, but in order to get that service paid for, they coded it. Unbundling or exploding charges. Patients or insured people's fraud. Doctor shopping, bouncing from one doctor to another to order or obtain multiple prescriptions. Identifying theft, obtaining or using another person's health insurance card. Misuse of insurance card, allowing some unauthorized person to use your identification card. Patients claim exemption from prescription charges when they are not in fact exempt. Third-party payer fraud, the agent or insurer falsifies reimbursement, falsifies benefit or statement of services. And then abuse, substandard care, providing unnecessary care, unnecessary cost to a program caused either by directly or indirectly via unnecessary care, failure to document. So abuse versus fraud. Examples of abuse. So refer exclusively to other providers for unnecessary services, charging excessively for services or supplies, performing a battery of diagnostic tests when only a few. So before we started looking at fee-for-service and all of this, we had a protocol that when you stepped into the emergency department, they would perform a multitude of tests that was just to do a catch-all of services. So if you show up and you don't have chest pain or any kind of sign or symptom that would indicate a cardiac event, you shouldn't have an EKG. Where before they would just go ahead and perform an EKG, a workup of lab as well as chest x-ray. Violate the Medicare physician participating agreement, submit bills to Medicare and not to third-party payers. So if you have auto or in-store or workplace, then you should bill them first and Medicare secondary. Require patients to pay for services not previously billed including telephone calls with a physician, prescription refills, medical conference with other professionals, fail to make required refunds when services are not reasonable, breach of an assignment, bill Medicare beneficiaries at a higher rate so that they get a higher fee for service, perform a battery of diagnostic tests. Insurance fraud, you have photocopies, provider signatures, lack of supporting evidence for surgical claims, incorrect spelling, improper medical terms. These are some of the red flags that you're going to see. Unassigned benefits over $500, physician bills for multiple visits without a prescription or related expense. So notice and proof. The goal of an insurer is to pay all valid claims promptly and with minimum paperwork. Group policies require written notice and proof of claim. Paying a claim here, the steps for reimbursement is we want to calculate the benefits in accordance to the policy. So fee schedules, deductible, benefits formula. Determine who is to pay, insured beneficiary or the provider. If there's a denial of claim, claimant is not covered. There may be fraud or misrepresentation. Claim fraud, it's a serious loss to the industry, which results in higher premiums. Fraud is the intent to deceive. And again, we have red flags. So material misrepresentation of facts, patterns of payment, exaggerations of injury, manufacturing of complaints and symptoms, fictitious services reported, alterations of medical bills, and non-existent insured scams. Claim submission fraud. So some characteristics that you're looking for. Insured and provider addresses are the same. So again, forgiveness of coinsurance or discounts by the provider. So you should have to pay your coinsurance. Provider using a PO box instead of an office location. Excessive charges, intensity or duration of services beyond expected norms. You should, if you have that, have to provide a special report to support those. Services with inappropriate diagnosis, attending physician claiming assistant surgeon before the surgeon files a claim, listing cosmetic surgery as functional procedure, and excessive utilization or illegal alterations of drug bill. Penalties for fraud and abuse. You have civil, criminal, and administrative. So civil is items or services not provided. Items or services billed as false or fraudulent. Medicare assignment provisions are violated. Items, services provided to an excluded person. Criminal is soliciting or offering, receiving bribe, kickback. Knowingly or willingly making or causing any false statement or misrepresentation for a Medicare benefit. And administrative against abusive practitioner, provider, supplier. Provider, practitioner, or supplier consistently failing to comply with Medicare regulations. So compliance, 7 basic components. This is one of the areas you're going to be questioned on. What is it a benefit or a risk? So we're looking at the 7 basic components. Again, you do have an OIG hyperlink within your study guide, so you do want to utilize that. It's going to help you answer those questions. Conducting internal monitoring and auditing. It does give you an example of that within there. Implementing compliance practice standards. Designating a compliance officer. Conducting appropriate training and education. Developing open lines of communication. And enforcing discipline standards through well-published guidelines to make sure that your employees understand them. So the benefits of having a compliance plan is you're going to reduce fraud and abuse. Formulate effective internal controls to ensure compliance with federal regulations, payer policies, and internal guidelines. Improve medical record documentation. Improved collaboration and communication cooperation among providers and those using information. Ability to quickly and accurately react to employees' operational compliance concerns. Concrete demonstration to the employees' community of commitment to honest and responsible conduct. Ability to obtain accurate assessment of fraud and abuse, and early detection and reporting to minimize false claims. OIG has identified certain areas that are risk. So billing for services, items not rendered, submitting claims for equipment, supplies not reasonably necessary, double billing, billing for non-covered services as covered, known misuse of provider identification number resulted in improper billing. So, for example, you have multiple providers, but because you can't bill that insurance company for a specific provider, another says bill under me, and then we will reimburse. That is a risk unbundling or billing each component instead of using an all-inclusive. So we want to use that comprehensive code. For example, that surgical and diagnostic laparoscopy is included when it's done at the same time. Instead, you would bill each individual. Failure to use modifiers properly. That's your CCI edits. In some cases, we can't use that 59 to unbundle procedures to get paid. Clustering, reporting one level of service for all patients' visits regardless of presenting problem or amount of work time spent. So you just automatically bill for a level 3 instead of a higher level or a lower level without the proper documentation. Upcoding a level of service rendered, reporting higher level of service regardless of problem or amount of work. That has to do with your evaluation and management. So that's your compliance, your fraud, your abuse, and also the benefits of what a compliance program should do, the benefits of having a compliance plan, and as well as identified risk areas of the OIG. So these are some of the questions and areas that you're going to have to answer on your certification exam. So this area should help clarify in your study guide.